Welcome back to MI for Change. I'm your host, Dr. Monica Gilbert. And today I want to walk you through a metaphor that I tend to use during my consultation session. And this metaphor is going to get a little wet. Hopefully not too wet. We're going to use a little bit of these gadgets over here. But before that, I do want to bring up this idea of what happens in sessions when we have that unspoken truth that we don't want to address, that pink elephant in the room. And we can even attribute this to different factors and personality factors. Some of us are more open to speaking about things, others don't know how to do it, so you don't really share. And others just shy away from confrontations altogether. And very few of us are like, yes, let's jump into it and let's tackle this because I don't want that awkward moment to continue to be an awkward moment. So here I'm holding a glass, and right now the glass is empty. So usually the way that it works is that when you pour a little bit of water, there's space. As you can see, there's a bit of water, but there's space for the water to move around. Everything seems good. Well, what happens if I keep pouring more water into this? And one way to see this is what happens when clients cancel last minute? What happens when you're working with the parent of your client and they're like, I never heard about that intervention, but this is the intervention that you've been talking about this entire time that they haven't been following through with? What happens when your client comes to session late and you already know that it's because you're avoiding that issue? What happens when you have to address a very uncomfortable situation with a parent and you know that it's there, both of you know that it's there, but they continue to do things that continue to push you to the point of frustration? Well, as you can see, every time that there's a challenge, this cup gets full and full of water. I'm not going to continue because it's going to get messy and the water is going to pour everywhere. But I think you guys get it. We tend to just become this cup. And this can be a metaphor for our patients, maybe our love, maybe just ourselves. And we continue to pour and pour and pour. And if we're not pouring out of this cup, then there's going to get a point where it's going to become overwhelmed and all the water is going to slip out and spill out. And that's exactly what happens. We tend to work like with clients that may sometimes be difficult, may be challenging, and we don't address the things that we have to address in a timely manner. And then it gets to a point that you just give up. You're like, I don't even want to work with this client. Or whenever I go to the session, my stomach turns, or I feel unwell just being with them. And that is that cup feeling overwhelmed and just spilling. So we want to make sure that we are preventing it from even filling up. A little bit is okay, it can still move around, but we don't want it to get all the way full where you no longer want to even be in the field that you're in because of all the burnout that you have. So, this is how motivational interviewing can help with this. Before I get into how we can use different skills in motivational interviewing to have those tough conversations, let's talk a little bit about this pink elephant in the room. And again, this is an obvious one, and I've seen it happen in so many different ways. For example, I remember once we had to tell a parent that we could no longer go to their school to provide services because honestly, the school was a headache. It was a nightmare. They were terrorizing our therapists, and we just didn't want to be there anymore. And it was a tough conversation because we had really great rapport, and that BCBA at that time had great rapport with the parent. She loved the kiddo, and she just felt like when she was going to bring it up, that she was going to not only crush that rapport, but that the parent was going to feel saddened. The parent was going to feel just, some sort of way about it. So she was very fearful in bringing it up. So what did she do? And this is a very ethical, very great BCBA, but what we always do, right? Negative reinforcement. We delay, we delay, we delay, we delay. And when it got closer, she was like, oh my gosh, now I really have to tell them. But not only do I now feel everything I felt before, but I even feel a little bad now because I have to tell the parent with like a very short notice. And we had a conversation about it because she came to me stressed out. And I said, okay, well, let's in the future learn our lesson and let's prevent this from happening. But again, it's important to have some courage and confront those situations, even if they are uncomfortable. But I also think that when you have the right tools and you're like, I've used these tools before, I know that they work, and I'm talking about communication tools, of course, then you become more courageous in tapping into that conversation, having those hard conversation with parents. I also had a couple years ago a child who it was sort of like borderline, not really abusive situation, but a little neglectful. And then mom was trying her best, but then dad was not really, doing what he was supposed to do. So the therapists were like on the verge of like, do we call the abuse hotline? Do we not? If we do, I think things are going to get worse with the parents and something may happen. So we were in the verge of that, and then something happened where we had to call. We had to call. And it was a tough conversation that the BCBA had to have with the parents. Imagine telling the parents, hey, I'm going to call the abuse hotline because this is going on. And this therapist had already filled up her cup. As we see over here, she had already filled out her cup. Things were going on. Things were being dismissed. And it got to a point where she was just like, I'm just going to tell them. And I said, okay, wait, let's find a nice way to say it, as nice as possible, and use more of these techniques. So again, the parent wasn't in love with the idea. They didn't stay with us because of obvious reasons, but they understood. At the end, it was a conversation that we had. And I think that that's where we have to focus. Whenever a parent wants to stop sessions, or even a client, when we're working with clients one to one, those clients that are like, look, this isn't working for me, or I don't want to try this, or I just can't seem to do this intervention, or they're making excuses because sometimes people do it indirectly, then just know that that's an invitation to communicate. They're inviting you to communicate with them. And when you see it as an invitation, it stops becoming so awkward, and you are able to actually use the techniques that inherently all of us have. We all have this. So, what are these techniques that we can use? And again, we don't want to avoid the pink elephant in the room. We want to acknowledge it and just bring it down and offer it and have that conversation about it. So, a nice reflection. And for those of you who are completely new to this podcast, if you listen or see or both, the previous episodes talk about the ORs. So the ORs plus I are these foundational skills of motivational interviewing. So, how do we tackle the pink elephant in the room? With a reflection. So, we are literally just reflecting on what that elephant looks like, right? So we would say something like, I've noticed that after that conversation we had, things got a little different between us. Is that the case? What do you think about that? Is there, can we talk a little bit more about it? So that's a nice reflection with an open-ended question that you can ask. Another open-ended question, or another skill, of the foundational skills that you can use, is what feels like the hardest part to say out loud right now? What is the hardest part of this whole situation? What are some questions that you have about this situation? I had a situation. I've said it like 100 times, but I've had a situation a couple months ago where a parent was so the therapist was getting to the session on time, and the parent loved the session. They found great value in it, but they continued to get there late. And every time that they would get there late, the therapist, of course, wouldn't say anything to a parent, even though we have a very strict cancellation policy, less than 24 hours. We, first of all, if we have to wait 15 minutes, then we don't have session, and then you're charged a cancellation fee. But anyways, this therapist, again, she was filling up her cup and she excused it. It happened. She excused it. It happened. I think this went on for like a month or a month and a half where the parent was getting to the session late. Sometimes they were just canceling last minute. Sometimes the therapist was even outside the door and they were canceling. And the therapist, despite her love for working with the kiddo and despite her how great she was, because she was really great, she came to me and she said, I can't do it anymore. I just can't. My cup is full and I don't feel like I'm going to be effective. I feel very resentful and blah, blah, blah. Right. So again, we spoke about making sure that when we have something in place, we do it from the beginning because it's putting boundaries as well. So instead of waiting for this to build up, let's put the boundary from the beginning and not later on. But also, let's have that conversation with a parent. So I sat down with a parent and I said, look, I've noticed that, and it wasn't an easy conversation to have, but I said, look, I've noticed that, you know, the RBT has been telling me that she's been showing up to sessions and these things happen. And of course, mom started, becoming very flustered and, oh, but I have this. You guys don't understand. I have these things that I'm like, okay, thank you for letting me know. That was gonna be my next question. So tell me a little bit about what are the challenges that you've been facing. And then she went ahead and she told me the challenges. And I said, yeah, and I mean, I understand your point of view. I also understand the point of view of the RBT and she's great and she works really well with your child. I wouldn't want her to stop working with him just because of this. Let's think about ways that we can address this and that moving forward, you understand what the guidelines are and that the cancellation policy will be applied right away. And, but also, I want to work with you. Is it the schedule? Is it the time? And she was like, yeah, I think the time is too early. I try to make it, but I can't. Okay, no worries. I'm sure the therapist will be okay with finding another time, but that she can actually have sessions. So we moved the session up a bit and it worked out well. Mom understood the whole situation. Now, the second part of this is the RBT coming in the next day because although the RBT was already like, I'm throwing my towel in, she was a little ambivalent about that decision because she also wanted to continue working with the child. And I said, okay, let's give it just one more shot. One more shot, work with me. And I coached her through the conversation. She said, okay, well, I'm going to walk in and I'll just, work with the kiddo and I'll ignore mom. And I said, no, we're not going to ignore. We're going to address. And I coached her through the process. So she was able to come in and speak with a parent about what happened because obviously the parent can only find out if she tells me about these things because she hadn't reported it. So she went in and she said, look, I understand that maybe you feel like I went behind your back or these things happen. I also allowed this to happen and I didn't put any boundaries. So that was my fault. I really want to get to a place where we can move forward and I really I love working with your family. I love working with you. I think we have a good relationship. I love working with this kiddo and I want to make it work, but I also have to make sure that my time is respected. So that was great. That was such a great conversation. And I was so proud of her. And I think she was proud of herself as well for having that conversation. So, again, it's important to address these pink elephants in the room because they're not going to leave. They're there to stay. And it's just going to make the situation, it's just going to make the environment feel toxic and feel bad and feel full of resentment. And even if it's going to take a little courage and maybe you have that bad feeling of, oh, I'm going to confront this. I don't know what's going to happen at the end of this. At least you are bringing these concerns up and at least you're addressing it, which is the most important thing. An affirmation that you can also use is it takes courage to even sit here feeling this way. So when you are working with that client or that parent, let's say that they're annoyed with you, or maybe you did something like, tell on them or something. So even bringing that up as an affirmation, I'm sure that you feel um a little slighted by what happened and I apologize for that. I think it takes a lot of maturity or a lot of love or a lot of courage for you to be here and have this conversation with me and continue to be open in bringing these things up. Right. So again, we're providing affirmations for the things that we want to increase, and we want the parent or that client to continue to be open and share these things with us. So again, we don't want to stay in the silence. We want to make sure that we are bringing these things up. And the same way that this works with conversations, this also works with yourself. So make sure that you are not filling up your cup to the extreme, that you're putting boundaries, and that you are having those conversations when you feel like the water is starting to fill up. I hope you guys found value in this session, and I will see you on the next episode. Thank you for joining me on today's episode of MI for Change. If you're ready to keep growing your motivational interviewing skills, I'd love to invite you to explore my MI Academy, where you'll find a full library of on-demand courses designed to help you put MI into practice with confidence. You can learn more at www.drmonicagilbert.com. Until next time, keep asking the questions that spark change.